Patients seeking treatment at the Teshie Camp 2 clinic may be placing their health at risk as the facility struggles to operate without a dependable water supply. Health workers at the clinic say the worsening water crisis is severely undermining care delivery. They report frequent water outages that make it impossible to wash bed lines or linens as properly as it should be, and they warn that the situation is spreading infections and endangering already vulnerable patients. This report has more.
A deepening water crisis is taking a heavy toll on residents of Teshie, particularly in the Camp 2 area. At the local clinic, nurses say the absence of running water has transformed routine healthcare into a daily struggle, with deteriorating sanitation contributing to the spread of infections within the facility.
Infection, because with the bed sheets, washing it is a problem. So I say spread of infection is really becoming high here, because we have to use water to wash the bed sheet before we can use it for another patient. But because we can't get water to wash the bed sheet, if the person lies on it and we see, oh, this one is not dirty, so let the other patient use it. Maybe you can't see it with your eyes that it's dirty, but it's really dirty. So infection is really a problem for us now.
To that, imagine wee-wee. Okay, somebody would have to use the washroom, and since there's no water to flush immediately, the next person will also have to do that until there's a pile up, and then we are able to flush. So there really is going to be an infection spread.
Health workers explain that the clinic frequently operates without water, making it impossible to wash bedspreads or disinfect washrooms after patient use. They say they are forced to buy sachet water with their own money just to provide basic care, a practice they warn cannot continue.
I had to go back home because I wanted to use the washroom, and then there was no water. And at that time too, there was no sachet water to buy. So I had to just rush, take a taxi, go back home, and then come back to the workplace.
Just imagine you having an antenatal or a mother who has delivered, and she really has to take her bath. You know, blood has a bit of a stench, so she will have to take a bath. So we really have to fill the buckets. Yeah.
So you see, from patient to patient, you have to wash your hands. But because there is no water, sometimes you are tempted to use the sanitizer to wash your hands. And then too much of it too is not really good. And then the sanitizer, I don't think it really helps a lot, because if you are doing invasive procedures and use sanitizer and then go to another patient, cross-infection. It's not really helping us, so they should do something about it for us.
We purchase water with our own pocket money, and we have to travel distances to fetch water. Sometimes 20 cedis a day for the gallons of water. So when you come to sachet, we spend like between 30 and 50 cedis.
The impact of the water shortage extends beyond the clinic. Food vendors in the community say the lack of water has forced many of them to halt operations, cutting off their primary source of income.
Oh, 50 down, 5 months now, 2 papi, me, Adriani. It's in right, call about the year, you could pay me, mammy, and me, Adriani. Me, Adriani. Yeah, the better cry, yeah, nebi. Edwani, nana me baby, me nebi, and fine Edwani. Me banner the lack of school, intimacy, me banner uniform yet. Yeah, nebi, Edwani, nepenny, or suton, and Africa, I call suton, and I call pensoir. Me the banner Edwani, nana me bay you. Me do me drown. It's one of me, me better crown, titway be pen, me the jolly, na me buy. Na me ben me don't hear me. Edwani crown me the ben crampo and sweat Edwani me the ben.
Pure water na eto na edi dware. Majai me nya nso mfanto. Na aduane no nso ono abi na me di. Me didi. Me ntumi nton na me nkoto aduane wa abontin. Nti onu a na me di. Me ntumi mfa nso enye nton na yare nchimi na yare nchimi nua bia. Obeto nso, obeto aduane no. Nti na nsan aduane no mantumi aye bio.
Residents also describe daily hardships, long walks in search of water, escalating costs of sachet water, and growing fears of disease outbreaks as basic hygiene becomes increasingly difficult.
It's a very difficult situation for the people of Suchuno Electra area, by extension, the whole of the municipality. Very precarious, very frustrating.